Few celebrities can grab headlines the way that Madonna has throughout her career, and her appearance at the Grammys has once again got lots of people talking. I'm a dermatologist, and today on the channel we're going to be breaking down what this change in her appearance is likely caused by and why it looks so striking to our minds. If you're new to the channel, I'm Dr. Dustin. I'm a board-certified dermatologist, and I use educational videos and humor to help you get the information to look and feel your best every single day. We're going to start with some of these before and after pictures of Madonna. When we look at her in the past, she certainly had one of those looks that's just kind of that classic beauty. Whether you loved her or hated her, many people still believe that she was really, really beautiful. But she's gone through many aesthetic procedures over the course of her career, and many celebrities try to do this. We can go back and look at many examples where people went way overboard with filler, with facelifts, with all sorts of cosmetic surgery and procedures to try to maintain that youthful look. So when we look at Madonna, she's clearly done that, and we don't know exactly everything that she's been through. And again, I'm not her treating physician, so this is going to be a little bit speculation, but we are going to talk about some things that are very likely. First off, why does her appearance look so jarring to the mind? Why is it so shocking and have so many people talking? Well, when we look at the classic definition of beauty, we have something called phi, or the golden ratio. There's this idea that faces that hold on to this golden ratio more closely are classically identified as being more beautiful. And this has been shown in study after study. When you give people a deck of photos to look at, those faces that more closely approximate this golden ratio of facial aesthetics are rated as being more beautiful than those that depart from it. So what exactly is this golden ratio? Well, we're going to talk about that. So phi, or the golden ratio in facial aesthetics, is a mathematical proportion that is often used to determine what is considered to be aesthetically pleasing in the face. In facial aesthetics, the phi ratio is used to measure the relationship between different facial features, such as the distance between the eyes or the distance from the nose to the lip and the chin. This ratio is considered to be a naturally occurring thing in the human body, and so for thousands of years of evolution, we've kind of determined in our minds, just evolutionarily programmed, that this is the definition of beauty. We looked at some of those images where we see all those lines on the face, and what we typically see is that the width of the eyes should be about 2/3 the width of the upper part of the face, and we have the bottom lip should always be a little bit bigger than the top lip, so when people do procedures and they get those lips just overfilled and they get the duck lips, where the top lip is the same size as the bottom lip, we typically find that to be not quite as attractive. So when we look at these photos of Madonna, she's completely changed the way that her face used to look. She used to have much more closely to that golden ratio, and now she's completely altered that. So when we look at it, her temples have been filled up with either fat transfer or filler to the point where the width of her eyes is about the same as the width past that, so it's 1/2 to 1/2. And that's not a look that really strikes the mind as being harmonious or beautiful. And so she's destroyed that golden ratio in many areas of her face, that it looks so round. We don't have the normal amount of hollowing that we see as we age. Even in younger individuals, a little bit of temporal hollowing is very normal, and we don't want to balloon the face up and make it so circular and round. We're also used to seeing these cosmetic subunits where everything is nicely divided. We know that we have cosmetic subunits from the upper eyelid to the lower eyelid, out to the temples. There's clear definitions in most individuals. When we look at the nose, we have the bridge of the nose, the nasal sidewall, and then the ala, and there's a clear crease right there that kind of defines some of those subunits. The same can be said for the upper lip, where we have this columella and the philtrum here, so that there's that natural little definition, and that tends to fade away as we age and lose collagen in the skin. We also know that we have these nasolabial folds, so that's a natural change in cosmetic subunit. And when doctors are doing reconstructive surgery, whether it's due to cancer or due to, a person just wanting a cosmetic procedure, great care is usually taken to preserve those cosmetic subunits so that the person maintains a more natural appearance. As we mentioned, many Hollywood celebrities have felt the need to overfill their faces in an effort to fight aging. Some have come out and talked about how that was a mistake, and they're going back to aging more naturally and gracefully, like Courtney Cox, for example. What Madonna has done is she's overfilled and kind of blended and blurred all of those cosmetic subunits so that she has very little definition from her forehead to her temples to her cheeks all the way down to her chin. It's so spherical and so circular that we don't see any real change or definition in those cosmetic subunits. The phi or golden ratio has been completely destroyed in most all of the areas of the face. Now, how would she have gotten like this? Well, it's possible that she's had facelift procedures which have lifted and tightened everything and then gone through filling procedures. Now, the types of filling procedures that can be done, of course, include hyaluronic acid-based fillers. These are going to be things like Restylane or Juvederm, Voluma, things in those families where we put them in and they actually draw water into the skin. As you know, if you're interested in skincare, hyaluronic acid binds water and attracts it to the area. And the same is happening when you put filler underneath the skin. It pulls water and gives extra volume. Now, hyaluronic acid-based fillers will go away over time, but depending on the one that you use can take months to sometimes even 2 or more years to fully dissolve and go away. Many celebrities who may be looking for a more permanent change and volume revitalization can do something called a fat transfer procedure, where liposuction is performed on a part of the body where they may want to have that taken from, like the waistline. If they want a little bit slimmer waistline, a doctor can do a liposuction procedure and then take the fat that is harvested, and typically it's going to be washed, so you remove the blood and everything that came out with it, and then that can be injected back into the face. In the case of fat transfer to the face, it can be injected into the butt if you're doing a Brazilian butt lift procedure. And the idea is when you inject that volume, some of that fat is actually not going to survive. And so this is a real art form because you want to put in enough to actually volumize and give a result, but you don't want to put in too much where it really overfills the face. And you have to account that maybe 30%, give or take, of that fat will die and actually not be there to provide volume. So oftentimes you're going to put in more than you would want, knowing that some of it just isn't going to survive and hoping you kind of land at that sweet spot where you get the result that you want. Now, we don't know if Madonna has had fat transfer or if she's just been using filler like Voluma, but whatever it is, it's clearly too much. It's completely blended all those different subunits of her face. If she went through fat transfer, they put in, you know, maybe a proper amount and more of it survived than they had planned on, or maybe they just overfilled it because that was the look that she was going for in an effort to fight aging. Or maybe, just maybe, this is Madonna just being Madonna and she's got everybody talking about her once again. I can tell you that as a dermatologist who does procedures like filler and Botox and some cosmetic surgery, that this is not a look I would ever do to a patient. It's not, I wouldn't want somebody walking around telling people that I had done this to them. And so I'm not sure who her doctor is. Hopefully she's happy with the result. And if that's the case, ultimately that's all that matters, because how you feel about yourself is more important than how other people feel about you. So yes, we are speculating about this. She is getting in the headlines, but I'm not really making a judgment. If that's how she wants to look, then more power to her. She has the means and the ability to do that. But if she doesn't want to look that way, hopefully she can get that corrected. But regardless, she's got everybody talking about her once again. Let me know what you guys think about Madonna's, I wouldn't say amazing transformation, but certainly a big transformation from her Grammys appearance. And I will see you back on the next video where we're going to keep covering trending topics in news in health. And we're going to talk about the products that you should be using on your skin and in the supplements for your body to help you look and feel your best every day. I'll see you on the next video.